No, she got ready to, then I think you called her off or something.
Yep.
Oh, so now my partner's just looking.
Yeah, she's on break. She's on union break right now.
Union, Arizona.
I thought she did all that earlier.
She's a pulse.
Yeah, she just did lung sounds and pulse. Okay.
Pressure.
So, what do you think is going on right now with this scenario, with this patient in this scenario?
Who, with him asking, why are you asking me about all the ED drugs?
No. Tell me, you got called out here, 80-year-old male, chest pain, prior cardiac history, he's got nitro prescribed to him. Okay, that's what we're thinking, right? He was outside working, scalping his lawn, right? He's got all these things are leading you down the road of a cardiac issue, correct? Okay. So, during your secondary assessment, when it says assesses affected body area, cardiovascular, what can you do for cardiovascular? You got pulses, you know how fast they are, but what else do you want to know about that pulse?
It's strong or weak,
Okay,
or it's ready,
right, the rate and quality, right?
right rhythm.
Rate, rhythm, you're not gonna get a rhythm because you don't have EKG, right? But you're gonna get rate and quality. And then, is it regular, irregular?
Yes.
Okay? Those are things that you need to ask. That's gonna get you your point for cardiovascular under secondary exam. Does everybody get that? Okay. So, pulmonary.
Respiratory rate.
Respiratory, you got lungs are clear and equal.
3 consecutive beats right around the third.
I saw it at 140 when I first
Could you hear it consecutively?
And
Get a
then
little
stopped it.
I guess so.
EBCs? We'll run a VTAC.
Not yet.
I knew it.
No, I don't care.
I was like,
I haven't blew my heart out doing cardio yet. It should be still good.
so 60
Okay.
again for breaths and 140 over 70.
Todd already leaned into the neurological side of things, okay? Any abnormal vision changes, any abnormal hearing changes, any headache, nausea, dizziness, blurred vision, okay? Those are indicators as well that you would wanna ask about with this, okay? Now, GI, GU. You asked if he's been going to the bathroom. What significance does whether somebody has dropped a deuce that morning have to do with their chest pain? At one
Oh, there
point
could
in the
be
afternoon?
strain, crazy on heart pressure, being old. not
Okay,
doing that.
that would be, that might be a relevant question if you get called and the person tells you that they were sitting on the toilet and having trouble. But if somebody's outside working and start having that chest pain and then they come inside, that whole bit, it becomes an irrelevant part of your body system.
All right.
Okay, what I'm trying to do is get you to start thinking about what, you have to get 5 body systems here, right? On the sheet, you have to hit 5 body systems. You don't have to hit 8. You can, but it's not necessary, because what are you under? You're under a time limitation. So if you hit 8 and you fail it by 30 seconds, where could you have shaved 30 seconds off?
Couple of those.
By not going over the 3 that were irrelevant. Does that make sense?
Yep.
Okay. Reproductive. Is there any reason to talk to him about reproductive issues?
Well, you could be
During-
taking ED medication.
Okay, but that comes into indications or contraindications for your medication. That's it, right? Nothing else. Unless you're hitting the guy up for a date, you don't care if he's on Viagra.
Well-
Other than outside of the nitro.
It could lead into later on when if I ask him, hey, are you sure you're not taking it? Because when if I administer nitro, I already know the answer.
Sure, but those are the questions that you ask him. He hands you the prescription, yeah, I have this, I haven't taken it yet though. Okay, you're confirming name, date, and you ask him about any contraindications. Okay, so some of your contraindications are what? Blood pressure,
or 100 and below.
okay? If he has taken any erectile dysfunction drugs, all right? So you ask him that, have you taken any erectile, no. Okay, I'm just gonna double check with you, just because of that it is, you're not supposed to take the nitro with an erectile dysfunction, it can have a deadly consequence. Have you taken any no, okay, boom. And now you're gonna assist him taking that medication, okay? The only reason you're asking him is because of the interaction of those two medications together, that's it.
Mhm.
So you're not using that, it's not a secondary exam.
Well, that's the only reason why it was using it.
Most people who are taking ED drugs aren't trying to reproduce.
Correct, they're beyond their reproducing years.
But I get where you're coming at, but yeah, it's really, I mean, reproductive, now that would be a great question for a female in childbearing years.
Yeah,
Perfect.
that's
For a guy?
predominantly, and that's gonna be like you've got her complaining of abdominal pain. Okay, then reproductive questions, a line of reproductive questions would absolutely be fitting. What we're trying to do is get you down the road so you're starting to think about what the actual complaint is, what your findings are, and what body systems do you need to evaluate for your secondary
Environmental
exam.
factors, what they were doing, where they were at.
But that doesn't fall under secondary exam, right? Environmental factors?
No, I'm just saying, like, they were outside, you don't need to worry about them going to the restroom. kind of thing.
Yeah, think about events leading up to the chief complaint.
Now, if this was a respiratory, I couldn't breathe, and everything's leading you down the, side of maybe anaphylactic shock, but then that environmental will be a big deal. Okay, were you outside, any, did you get stung by a bee, things like that, but for a basic chest pain, you're focusing on just that.